Hi friends, welcome back to my channel. Today I'm here with some useful positive languages for OET speaking. As you know, s- the speaking assessment communication skill is one of the mandatory assessment criteria. So it's very important to maintain a good rapport between the patient. So by using positive language, it will help you to gain the patient's trust and build a good health professional patient relationship. In addition, it will also help you to reassure or persuade a patient to follow your advice. Sometimes, in the real scenarios, we can see many patients are reluctant to follow the doctor's advice or they don't want to perform any procedures because of their misunderstanding or they're not much aware about that situation. So, in order to convince that patient, we have to reassure them. First, we have to know how much knowledge they have regarding that disease condition. Then, according to that, we can reassure them. So, in order to reassure or appreciate them, we should know some useful words or languages to use in this situation. So, I can provide some examples here. So, first one, if they have some questions they ask you to or they have some concerns, we can encourage them by asking, that's a good question, Mr. John, and I will explain it to you now. So they will be more happy. So it is a mandatory requirement in the OET speaking. We should be more empathetic. That means we have to put our feet in their shoes so we can understand their feeling as well. So, in that way, when we communicate, we can handle the situation more nicely. And another example I would like to give is that if they ask you again some questions regarding the disease condition or any treatment, we can tell that I'm glad you asked and let me explain the procedure for you. So will be their situation will be more eased, they will feel much relaxed. And sometimes this patient is reluctant and they are so concerned about their children, means the parents are concerned about children treatment, and especially they cannot stay in the hospital because of the hospital policy. We can reassure them that the staff here are very experienced and they will take good care of your daughter or son, so nothing to be worried. So, no need to alarmed about your child or the situation. We will handle it in a nice way. So, they feel much relaxed as well. Then, another fact I would like to mention is that we should be a good listener during the speaking session. Then only we can answer them properly and we can get a higher score in the speaking module. If we just focus on the role play card what we got and we are not focusing their answers, it will affect our score as well. So next example is that sometimes the patient have not much awareness about this situation or disease condition. We can explain it very well and we can give the what are the side effects or the leading complication it can cause, so they may get some awareness and gradually they will follow the doctor's order or they want to stay in the hospital. Sometimes they want to discharge home early and they will raise some reasons behind that, so we should ask them, could you please tell me what's the reason behind that? Do you want to discharge home early or do you want to stay in the hospital? Some are refusing for discharge. So once we get their answer, we can nicely explain to them regarding the complication. If they want to stay in the hospital more time, it can cause some hospital acquired infection. So I hope you understand all this For some patients, if they refuse for any surgery, we can tell that the surgeons at this hospital are very experienced with this procedure. So you don't need to worry too much. They will take good care of you. So, what about the patients, those we are advising them to stop alcohol consumption or quit smoking? We can advise them that I know it sounds difficult at first, but with practice, you can gradually stop this habit. And many of my patients have attended some quit smoking program, and as a result, they have been able to quit smoking successfully. So, I'm quite sure it can help you as well. So, in that way, we can persuade them to stop smoking. So, these are the steps I would like to apply in the poetry speaking. Okay. So, friends, first we have to maintain good relationship. We should listen to them and we should reassure and appreciate them. But don't forget to get permission in between if we are asking some questions to them. Okay. So, in between, when you are talking and asking question or explaining, you should be empathetic with them. Should tell them if they are complaining, if they are telling about their pain or difficult situation, you should say, "I'm so sorry to hear that you are in that situation, but no, nothing to be worried. We are here to support you." So, it will be more assurance, give assurance to them. So in that way we can maintain a good rapport with the patient. So friends, these are the useful tips I would like to give you. So if you like my channel, just like it, share it and subscribe it and press